I'm Paul Hochfeld. I'm a retired emergency doctor. My 60-second elevator speech starts with, we don't have a healthcare system, we got a non-system, and the taxpayers are being ripped off. 60% of our healthcare expenses go through the government as taxes. 60% of every dollar spent on healthcare. That's the first thing you need to remember. And we're the best, the only developed country in the world that dices its population into risk pools. And, all right? And there are easily identifiable risk pools. And let me just tell you that the taxpayer is paying for all the high-risk / expensive risk pools. The taxpayer is paying for old people, disabled people, Medicare, poor people who have excess health costs because health follows wealth and social determinants of health, and everybody here knows about that. Old people, disabled people, poor people, Native Americans, vets, and active military. Those are all really expensive patient populations, risk pools. Then the taxpayer subsidizes insurance companies. Employers' health care premiums are deductible. That's lost revenue to the federal government that appears as a line item in the federal budget. So the taxpayer is subsidizing health care for employers to get insurance. With the Affordable Care Act, they're now subsidizing low-income people who don't qualify for Medicaid because if you go through the exchange and you meet certain income limits, you get subsidized. So the taxpayer is subsidizing the insurance companies to care for the low-risk people so that they can profit from it. All right? The insurance companies spend 15 to 20% of every dollar that they get subsidized by the taxpayer on administrative costs, which include profit. And it gets worse because the providers, instead of dealing with one payer, has to deal with all of these different insurance companies, and it costs the providers a lot of money. I don't know what it is now, but back in 2009, I believe the average primary care doctor spent $64,000 a year in billing and collecting.
Up to $86,000 now.
$86,000 now. That's what it costs a primary care doctor to argue over money with the insurance companies. So having to deal with all those payers increased total cost by 20%. That's the important number. Costs us 20% of every healthcare dollar to service the insurance companies who are profiting by the low-risk people while we're paying for the high-risk people. The taxpayer's getting ripped off. Grrr.